Dr. Elias, you practice integrative medicine. Can you just give an overview of what that is exactly?
Yeah, definitely. I actually, Scott, every lecture I start, today I talked at Cancer Control Society about the role of modified citrus pectin and polybotanical in cancer. But I always start with integrative medicine, and no, I don't know how many times I already lectured on it. It's always exciting because it's a term which is almost a cliche. And I know when I train doctors a lot, and they kind of skip it. They want to know the details, the protocols. But really, the journey of understanding, comprehending, holding, and using integrative medicine is a profound and long process. It's a lifetime of learning. Why? Because integrative medicine has a number of principles that are not easy, not only to comprehend, but harder to practice. What are the principles of integrative medicine? First of all, integrative medicine, from the basic concept that it's integrated, is that it's really patient-driven. We want to create a certain integration for the patient. And as part of it, we need to listen to the patient. So in my clinic, for example, there are no white coats. There are no diplomas. I don't sit behind a desk. The patient chair and my chair are the same. Actually, the patient has a nicer chair. And the patient is placed in a place where they are the ones who look out of the window and have beautiful view. We give the patient we empower the patient. So the patient can feel free to express themselves. You know, in integrative oncology, we are faced with many patients who say, I can't tell my oncologist that I'm doing something, they will get upset. I mean, think about it. Here is a patient who may be dying from a disease, so stressed, and they have to be worried that their doctor is going to get upset. So by making it a patient-driven medicine, this issue is gone. That's the first principle. But it means that the doctor has to come in without an agenda. And that's the second principle. Integrative medicine is non-biased, which means we are open-minded. Especially in cancer therapy, I want to emphasize that it's really about integration. Pure alternative methods rarely really work. It's about integration. So the open-mindedness means that we cannot be biased. We need to be open to things like surgery, chemotherapy, radiation, hormonal therapy, when done in the right time, in the right place, and to be open to acupuncture, nutrition, shamanic healing, prayer, etc. And I can tell you so many stories to show how they come together. So that's the second principle. The third principle, which is the hardest to learn, is that the medicine has to be individualized. Integrative care is to be custom-made for the patient. People ask me what protocols you use. And my protocol is that I have no protocol. It depends on the patient. Gender, age, education, lifestyle, philosophy, goals in life, etc., etc. And it's a very dynamic process, especially when you utilize from medicines like Chinese medicine, Tibetan medicine, Ayurvedic medicine, that deal with the movement of time and seasons and time of the day. You create a very dynamic process where you allow the patient to interact with time and space, with nature. So these are really the principles of integrative medicine. The way to implement integrative medicine is what I call through the path of knowledge and wisdom. Knowledge is information. So looking at my specific journey, so I'm trained in Western medicine, and I'm trained in Chinese medicine, and I'm trained in classical homeopathy, and I have training in nutrition, and I'm training in shiatsu and craniosacral osteopathy, and I was a yoga teacher, and I meditate. So I have this component. I created a circle. But it's a very linear thinking, different methods. The wisdom is a letting go of the concepts. It's a non-conceptual understanding. The deep intuition that comes from an open mind and letting go, and from an open heart. So the true expression of the healing through integrative medicine is naturally flowing, uninterrupted, and effortless love and compassion. One thing about love and compassion, you can never have too much of it. There is no danger. So it's a life journey to expand our heart for ourselves and for others. And I think one great example, if anybody met His Holiness the Dalai Lama, even from far away, you just look at him and you can feel this quality. So we want to bring this quality into medicine, and it's not easy. It's not easy in insurance-based medicine, and it's not easy with stress, it's not easy with the Western style of pace, and I often fail in doing it. My specific lifestyle to address it is that for the last 20 years I spent 2 months a year on retreat, and I just came back from 2 years being on retreat. But for many, many years, since 2004, I meditate for half a day, I open my heart, I open my mind, and I offer it to others in the second half of the day. Now, not everybody is fortunate to create such a schedule, but even if you touch it a few minutes here and there, as a patient and especially as a healer, doctors used to be healers and philosophers. And it's really a part of what integrative medicine is. It's what I'm most passionate about talking, because I have a lot of trick, I have a lot of method. You can see I'm a researcher, I'm a formulator. I publish heavily in peer-reviewed journal, and I'm respected in the scientific community. But really what I care is about this message of an open heart. That's when miracles happen, sometimes without doing anything.